viewers. Ever found yourself questioning the mysteries behind heavy menstrual bleeding? Wondering why your period seems to have a mind of its own? Well, today, we're taking a deep dive into the world of menorrhagia. Have you ever felt like you're in a race against time, changing tampons or pads constantly? Or perhaps you're on the lookout for a superhero solution to those pesky period problems? Join me on this journey as we explore the ins and outs of heavy periods, answering your burning questions along the way. Ready to unravel the secrets of menorrhagia? Share your thoughts and questions below, and let's dive in. Sarah walked into my clinic with a weary look on her face. She was experiencing heavy menstrual bleeding, and it was taking a toll on her energy levels. As she sat down, I could sense her frustration and the physical exhaustion she was dealing with. With empathy in my approach, I asked Sarah to share her concerns. She opened up about how the excessive bleeding was making her weak, lethargic, and overall impacting her daily life. It was evident that she needed support not just medically but emotionally as well. I took the time to explain to Sarah that she wasn't alone in this, and we could work together to address her concerns. We delved into the potential reasons behind her heavy bleeding, discussing hormonal factors and other health considerations. My goal was to assure her that we could find a solution to help her feel better. Heavy menstrual bleeding, formerly called menorrhagia, is when your periods are extremely heavy or prolonged. Heavy means that your period lasts longer than 7 days or that you lose more blood than is typical during menstruation. You may bleed so much that you have to change your tampon or pad every hour for several hours back to back. You may pass blood clots the size of a quarter or even larger. Menstrual bleeding that's so heavy that it interferes with your daily life is never normal. Your provider can recommend treatments to manage heavy blood flow. Heavy period bleeding is common, affecting anywhere from 27% to 54% of people who menstruate. Heavy menstrual bleeding can be serious if you lose so much blood that you show signs of anemia. Anemia is a condition arising from having too little iron in your body. Anemia can be life-threatening without treatment. Also, some of the conditions that can cause heavy period bleeding, like cancer, require early medical intervention. Signs of heavy menstrual bleeding include abdominal pain, periods lasting longer than 7 days, passing blood clots that are the size of a quarter or bigger. The blood may appear red, pink, brown, or even rust-like. Bleeding through one or more tampons or pads each hour for more than 2 consecutive hours. Losing more than 80 milliliters of blood during your period instead of what is typical, 35 to 40 milliliters. Anemia symptoms, like feeling exhausted, tired, or short of breath. With anemia, you may also notice signs of a condition called pica. Pica symptoms include hair loss, pale skin, and the urge to eat non-food items, paper, hair, dirt, etc. See your provider if you have these symptoms. Heavy menstrual bleeding interferes with your quality of life. Many people with heavy periods assume that periods are supposed to be inconvenient and uncomfortable. They may have watched people in their families live with heavy periods without seeking care and followed their example. But periods should never cause you to restrict activities or accept inconvenience. During your period, you should be able to wear a standard pad or tampon every 3 to 4 hours without changing it. Wear a single menstrual product without having to double up, wearing 2 pads or 2 tampons at the same time, at any point. Leave your home without having to pack extra bags of pads or clothing changes. Live your life as usual, without missing work, avoiding going out in public, or skipping activities you enjoy. If your periods are disrupting your life, it's time to see your provider. Heavy menstrual bleeding is a period that lasts longer than 7 days. How long you bleed depends on what's causing your bleeding. Heavy menstrual bleeding can have many causes, ranging from hormone-related issues to various medical conditions and even stress. The hormones that your body produces, like estrogen and progesterone, help regulate your menstrual cycle, including how heavy your periods are. Having a condition that causes your hormones to become imbalanced can lead to heavy period bleeding. Causes include anovulation, thyroid disease, polycystic ovary syndrome, PCOS, Weighing more than your ideal body weight can interfere with your body's hormone production and lead to heavy menstrual bleeding. 2. Benign growths in your uterus and conditions that cause cells in your uterus to grow improperly can cause heavy menstrual bleeding. 2. Causes include polyps, fibroids, adenomyosis. Conditions that increase your risk of getting cancer, including endometrial hyperplasia, as well as cancers that affect your reproductive system, can cause heavy menstrual bleeding. These include uterine cancer, cervical cancer. Infections, including sexually transmitted infections, STIs, can cause heavy bleeding. These include gonorrhea, chlamydia, chronic endometritis. Heavy bleeding can be a warning sign of pregnancy complications, such as miscarriage, ectopic pregnancy, C-section niche. High numbers of cesarean sections can lead to a scar that creates a pocket in your uterus. That pocket can collect blood, which you can later bleed. Heavy menstrual bleeding is a symptom associated with various conditions, including bleeding disorders and non-bleeding disorders. Some common medical conditions that can lead to heavy bleeding are von Willebrand disease, liver disease, kidney disease, pelvic inflammatory disease, PID, leukemia or platelet disorders. Certain medicines can cause heavy menstrual bleeding, too. These include blood thinners and aspirin, hormone replacement therapy, tamoxifen, breast cancer drug, intrauterine devices, IUDs, birth control pills and injectables. Failing to remove contraceptive devices when needed can also cause abnormal uterine bleeding. Your healthcare provider will ask a series of questions about your medical history and menstrual cycle to diagnose heavy menstrual bleeding. Your provider may ask about your age when you got your first period, the number of days your period lasts, the number of days your period is heavy, family members with a history of heavy menstrual bleeding, your pregnancy history and current birth control methods, current medications you're taking, including over-the-counter ones. Come prepared to talk about your quality of life, too. Your provider needs to know if you've been doubling up on menstrual products, avoiding activities or placing restrictions on your life in any way because of heavy periods. Your provider will do a physical exam and a pelvic exam. Many non-invasive procedures are available that can help your provider diagnose what's causing your bleeding, such as a hysteroscopy to check for polyps, fibroids or other irregular tissue in your uterus. Hysteroscopy allows your provider to inspect your vagina, cervix, and uterus. Your provider can remove growths that may be causing your bleeding, like fibroids or polyps, during a hysteroscopy. You may have other tests, depending on your age and how severe your symptoms are. Other tests may include a blood test to check for signs of anemia, clotting issues, or thyroid disease. A pap smear to study cells from your cervix for changes that may indicate cancer. An endometrial biopsy to check uterine tissue for cancer cells or other irregularities. Transvaginal ultrasound to check the appearance of the organs and tissues in your pelvis. Magnetic resonance imaging, MRI, to check for abnormal structures inside your uterus when an ultrasound doesn't provide enough information. A cervical culture to test for infection, as indicated by your medical history and the results of your physical exam. Treatment depends on what's causing your bleeding, how severe your bleeding is, your health, age, and medical history. Also, treatment depends on your response to certain medicines and your preferences. For instance, you may not want to have a period at all, or you may want to reduce your bleeding. In addition, your plans to get pregnant will affect your treatment options. Talk with your provider about your health concerns and your goals for treatment. Iron supplements improve your iron stores. Non-steroidal anti-inflammatory drugs, NSAIDs, can ease your cramps and reduce your bleeding. Vaginal ring, patch, IUDs, may help make your periods more regular and lighten your blood flow. Hormone therapy, HT, can help balance the amount of estrogen and progesterone in your body so that your menstrual flow isn't as heavy. HT is often recommended for heavy menstrual bleeding associated with perimenopause but comes with risks that you should discuss with your provider. gonadotropin-releasing hormone, GnRH, agonists can temporarily stop or reduce bleeding by preventing ovulation. Desmopressin nasal spray can stop bleeding associated with von Willebrand disease by helping your blood clot. Antifibrinolytic medicines, like tranexamic acid, prevent clots from breaking down and causing excessive bleeding. Procedures used to treat heavy period bleeding. Hysteroscopy is often used to diagnose and treat heavy period bleeding. With an operative hysteroscopy, your provider inserts a thin, lighted tube into your vagina that allows them to inspect your uterine cavity. The hysteroscope acts as a precise surgical instrument, too, and can help your provider remove any growths that may be causing your bleeding. Other procedures include myomectomy, a procedure that removes fibroids from your uterus. Uterine artery embolization, UAE, a procedure that restricts the blood flow from fibroids and tumors. Endometrial ablation, a procedure that destroys all or part of the lining of your uterus. Often, your provider will recommend sterilization afterward. Endometrial ablation puts a fetus at risk of serious complications if you become pregnant. Hysterectomy, surgery that removes your uterus and prevents you from having periods or getting pregnant. How is heavy period bleeding managed? Treatment may begin with medication and then progress to minor procedures and surgical options. What is the prognosis for living with heavy menstrual bleeding? Left untreated, heavy periods can interfere with your life. In addition, heavy menstrual bleeding can cause anemia and leave you feeling tired and weak. Other health problems can also arise if you don't get help. With proper treatment and assistance from your provider, you can manage heavy periods without compromising your well-being. Our journey together unfolded like a story. Each visit was a new chapter where we assessed her progress, adjusted our approach, and celebrated the small victories. Sarah began to realize that there were tangible steps we could take to improve her quality of life. As time went on, the exhaustion started to lift, as Sarah regained her strength. Our story became one of resilience and progress. The clinic transformed into a supportive space where Sarah found not only medical guidance but also encouragement and understanding. Our collaborative efforts turned a challenging situation into a narrative of triumph over adversity. Sarah's heavy periods were no longer an insurmountable obstacle but rather a challenge she faced head-on, with our clinic serving as the backdrop for her journey toward a healthier, more balanced life.